Hi, I am Dr. Sylvie Ribbon, and I am here to talk to you about breast cancer. We have a guest here today, Mr. Richard Legal, who is here to talk to you about his challenges and his battles of breast cancer. So, can you please tell the audience what is breast cancer?
Good. Um, Breast cancer, as it was explained to me, is a malignant cancer tumor that starts from the cells of the breast. Mostly in women, rarely in men. I unfortunately was one that was diagnosed with it pretty early. And, I've been in treatment for the past 6 months and treatment seems to be doing well.
Okay, how did you feel when the doctors told you were diagnosed with breast cancer?
At first, shocked because usually breast cancer, you typically find that in news and people that you know, women usually the ones that gets breast cancer. So hearing this was really, really shocking. I thought they made a mistake. But eventually I was convinced after seeing tests, and I realized that yes, I did have breast cancer, and I was a little bit taken back, very scared at first. I was um, hoping that because of my early diagnosis, I would be treated and be successful in whatever treatment they gave me.
Okay, what specifically, like, what type of treatment did you have to go through?
Well, I went through chemotherapy, which is most of the times that's the treatment that they do give breast cancer patients. And chemotherapy, from what I was explaining, is used to weaken and destroy cancer cells in the body. It was used for me mainly because I was diagnosed very early.
Okay.
Very early, and as I said, that was one of the main reasons why chemotherapy, I was a good candidate for chemotherapy because I was diagnosed very early.
Right. I know it's rare for a male to be diagnosed with breast cancer, but how did you deal with it? Like, how did you feel when the doctors told you that you were diagnosed with this? How, even though you were a male, how did you deal with it?
Well, at first, as I said, it was very scary because you never hear men having breast cancer, so it was very scary. The doctors at the hospital made me very comfortable. I think information is important, alright, because the more information that you know about this cancer, the more comfortable you come with whatever treatment is given to you, and the more confidence you get that you could be healed. So yes, at first it was a very scary thing to deal with, but now I'm pretty confident I'm going to beat the disease and be taking it one day at a time.
Okay, if you don't mind me asking about your personal life and things like that, do you have any kids, their ages, and were they supportive of when you were diagnosed with breast cancer?
Yes, well, I have one daughter, and she was very supportive in terms of wanting to find out everything about it. She actually went on the internet, was telling me stuff that I didn't even know. So yeah, she was very supportive, and she being a woman, and me, of course, having that gene, which I'm guessing I got it from either my mother or my grandmother. It's a normal gene that is passed down from maybe my mother to me, or maybe my grandmother to my mother to me. So she is someone who might have that same gene, and I suppose she was maybe not only doing it for me but for herself. So she gave me a lot of information, and she was very supportive, and I guess, you know, that helped me through it a lot.
And how old is your daughter?
She's 13 years, thinking she's 27 actually. You know?
Okay. Do you have a wife?
Ex-wife.
Well, she was your wife at the time,
Yes,
right?
at the time she was my wife.
Okay. How did she deal with it?
Well, she dealt with it. She was very supportive too. I mean, I think she and me having breast cancer kind of allowed people that were close to me, females, my ex-wife, her mother, sister, they all went and get tested. So, unfortunately, yes, I had breast cancer, but I think it opened up the avenue for them to get tested, and they got tested. Fortunately, they are okay. But the support from I don't think I would have gotten where I am today without the support of my ex-wife and my daughter. They were marvelous.
Okay, and if you have any tips for males or females that are going through this at an early stage or going through chemotherapy or even later in their breast cancer stages, do you have any tips or advice to give them?
I would say even before knowing that you have, the key tip is going and taking a test, male or female, to find out if you do have breast cancer. Because sometimes early detection is the best form of trying to battle this disease. Early detection. The longer you wait, is the harder it is to overcome. In my case, it was early, so I would say early detection is the best way. And not because you're a man, that doesn't mean that you're not going to be affected, because look at me, I was affected. The other thing is the positive thought. To think positive. Alright? If you go and you have a sense of, oh, this thing is going to defeat me, then I think, the chances of you beating it is much harder. You have to have people around you that are supportive and positive. So I think early detection, positive thought, and the right treatment. Going to specialists who know what they're doing. All these things are key factors in recovery.
Okay. Thank you for this wonderful interview.
What I could also say before we go is that there are symptoms that I suppose,
right, I forgot to ask you.
That's okay. There are symptoms that you should, male or female. If you see these symptoms, then you should take note and not ignore them. And the symptoms being swelling along the chest for a man, of course breasts if you're a woman, swelling around it. Skin irritation, sometimes that happens. I didn't have that, but skin irritation is something that, if you see that around the chest area or breast area, that is something that you should go to the doctor and check that out. Also chest pain, okay? I mean, that could be a simple thing. It will have to be breast cancer, but you should check it out. Redness around the chest, very important. If you have redness around the chest, around the breast for a woman, that is something that those are symptoms. And of course, lump under the arm. Okay, if you have that lump, then that is something that you should go and check. And on a daily basis, when you're taking a bath, you should just feel around the chest area, breast area for a woman, and if you do discover something abnormal, whether there's a lump, it's something that you should go to the doctor right away, because as I said, early detecting it early is key to getting rid of this cancer.
Okay.
Alright? And for all those who haven't been tested, it's a simple test. You could do a physical test, but there's also a test that they do. And if you have cancer in your family, then of course you're at a higher risk of getting it, and you should go to the doctor and a yearly visit. That's all it takes. And it's a quick check, is something that everyone should do.
Okay.
Okay?
Thank you very much, Mr. Laval.
Thank you very much. All right.
Thank you.
Have a good day.
You too.
Bye.
Bye.